Have you ever stopped to think about allergies, beyond yourself? Or even your dog or cat?
Hmm.
Like, what if a camel's constant itching wasn't just a simple allergy, but maybe a signpost for something more serious, like a nasty infection?
Right, a diagnostic clue.
Exactly. Or get this, how about deer? Playing this kind of secret role in a really fascinating, sometimes even life-threatening food allergy that affects people all over the world.
It definitely makes you look at the whole picture
It
differently.
really does. So today, on the deep dive, we're plunging into this, well, surprising world of allergic hypersensitivity in two pretty incredible animal families. Camelidae, that's your camels, llamas, alpacas, and Cervidae, so deer, elk, moose.
It's a great topic. Lots of unexpected connections.
Okay, so let's try and unpack this. Our mission really is to give you a shortcut to being well-informed about this pretty complex world of allergies in these animals. We're going to explore what makes their immune systems maybe a bit different
Yeah, unique in some ways.
and discover how their allergic reactions might differ and maybe uncover some surprising links, especially where human health comes in.
Exactly. We'll start with the basics. Ground ourselves quickly in the science of allergies. Then we'll dive deep into each family.
Compare and contrast.
Right. Look at their specific immune features, the challenges in actually diagnosing and managing these things. What's really fascinating is how their evolutionary journeys have led to these profoundly different allergic profiles.
And different roles in the ecosystem, too.
Absolutely. And often that has direct implications for us, for human health.
Okay, so before we get into the nitty-gritty of camels and deer, let's just make sure we're all on the same page. How allergies actually work. When we say hypersensitivity reaction, what exactly are we talking about?
Okay. So at its core, a hypersensitivity reaction is basically an immune system going a bit overboard.
Oh.
Yeah, exactly. Yeah. It's an exaggerated, or you could say inappropriate response to something that's usually harmless, what we call an allergen. But the response itself ends up causing actual tissue damage, clinical signs.
So it's like your body's security system, but it's freaking out over a delivery guy instead of a burglar.
That's a pretty good analogy, yeah. It's hitting the panic button for something that isn't really a threat.
So when most of us think allergy, that classic reaction, we're probably picturing what's called type I, right? Immediate hypersensitivity.
That's the one. Type I is the immediate, often quite dramatic reaction. It's all mediated by these specific antibodies called IgE.
IgE, right.
So when a susceptible animal first encounters an allergen, its immune system makes these IgE antibodies. And they then essentially arm specialized cells, particularly mast cells. Think of them as little grenades ready to go off.
Okay.
Then the next time that same allergen shows up, it acts like a key. It binds to the IgE on those armed mast cells, unlocks them, and boom, they rapidly degranulate, releasing this flood of potent inflammatory chemicals. Histamine is the famous one, but there are others. And that causes an almost instantaneous reaction.
And what does that look like in these big herbivores? It can get pretty serious, can it?
Oh, absolutely. The onset is incredibly fast, sometimes minutes. In severe cases, you get systemic anaphylaxis. That's a widespread, potentially life-threatening reaction.
Whole body shock?
Pretty much.
Yeah.
It might involve, say, acute respiratory distress.
Mm-hmm.
In some animals, like cattle, the lungs are a major shock organ. But you can also see more localized things.
Like hives.
Exactly. Urticaria, those raised, really itchy bumps or welts we call hives. Or angioedema, which is a deeper swelling, maybe around the face, lips, eyes. It's obviously very uncomfortable for the animal.
And you mentioned these reactions often pop up in specific places, especially for animals grazing, interacting a lot with their environment.
Precisely. For large herbivores, the skin and the respiratory tract are kind of the front lines, right? The main interfaces with the outside world. So they're common targets.
Makes sense.
So on the skin, you might see intense itching, we call it pruritus, along with hives, or maybe a chronic allergic dermatitis. That can lead to redness, hair loss, even secondary skin infections because the animal is scratching itself raw.
Ouch. And respiratory.
Yeah, inhaled allergens can cause allergic rhinitis, sneezing, nasal discharge, maybe watery eyes, sort of like hay fever. More severe cases might look like asthma with coughing, wheezing, difficulty breathing.
You hear those symptoms and they sound pretty familiar, like allergies in people or even pets.
They really do. It shows how some of these basic immune response pathways are pretty conserved across different species. Very universal in some ways.
Okay, so understanding those general principles, it really makes you wonder how an animal's unique biology might put a twist on that allergic playbook. And when we talk unique biology, camelids, wow, they're really something else, aren't they?
Oh, absolutely. Their immune system has this. Well, you could call it a secret weapon. They
Oh.
produce something called heavy chain-only antibodies, HCCABs.
Heavy chain only, so different from ours.
Very different. They make these in addition to the conventional antibodies most mammals have.
Yeah.
And these HCCABs, particularly the IgG2 and IgG3 types, can make up a huge chunk, like up to 75% of the total circulating IgG in camels.
75%. Wow. So what makes them so special? What's the aha moment here?
Well, the truly revolutionary part is their antigen binding domain. Instead of the usual two chains, it's a single variable domain. We call it a VHH or sometimes a nanobody.
Nanobody, because it's small.
Exactly. Think of an antibody that's smaller, more stable, more nimble. It can potentially bind to parts of antigens' epitopes that conventional antibodies just can't access, like a tiny molecular key getting into difficult locks.
That sounds incredibly useful.
It is. This isn't just a biological curiosity. Researchers are actively harnessing these nanobodies. There's real potential to use them therapeutically, maybe even to block the IgE pathways involved in human allergies.
So these camelid nanobodies could actually help treat our allergies. That's amazing.
It's a very exciting area of research, yeah. Huge therapeutic potential.
But, okay, here's a twist for people who own or treat camelids. You see signs that look like allergies, but it's often not a straightforward allergy, is it? It can be something else, masking as one.
You've hit on a really critical diagnostic challenge. It happens frequently. For example, those urticarial plaques, the itchy welts we mentioned.
Yeah.
In a camelid, that could actually be a sign of trypanosomiasis. That's a serious parasitic disease, also called sura, very different from a simple hive reaction.
Wow. Okay, so itchy bumps could mean parasites.
Or, say, severe itching, skin damage from the animal rubbing and scratching itself. That might be sarcoptic mange, which is an intensely itchy skin mite infestation. So you absolutely cannot just assume allergy. You have to dig deeper, rule out these other major things first.
So what are the actual documented primary allergens that cause true allergic reactions in them when it is just an allergy?
Well, while those mimics are common, they do get primary allergies. Documented allergens include things you might expect, like protein-based ones, camel dander itself, for instance.
Right.
Also, milk proteins. And this is surprising because camel milk is often promoted as hypoallergenic,
Right, I've heard that.
but it has caused severe allergic reactions in humans. So it's complex. Insect saliva is another one. Biting flies are a common trigger, and certain components in their feed can cause issues.
And sometimes it's things we do to them.
Yes, iatrogenic reactions. Reactions caused by medical treatment. For instance, certain 5-way leptospirosis vaccines have been linked to type 2 hypersensitivity or even anaphylaxis in some camelids. And even things like B-complex vitamin injections have occasionally been associated with itching, with pruritus.
Okay, so with all these possibilities, true allergies, parasite mimics, reactions to treatments diagnosing a genuine allergy in a camelid sounds incredibly difficult, especially if they're not tame.
It absolutely is a challenge. There's a real lack of species-specific validated tests.
Yeah.
And just the practicalities of working with non-domesticated or semi-wild animals in their environment. It's tough.
So how do vets approach it? What tools are available?
Well, it starts with a really thorough clinical history and a careful physical exam. Then it's about a systematic approach, ruling things out.
What kind of tests can be done?
We can use serological testing blood tests. There are commercial camel-specific IgE enzyme immunoassays available now, trying to detect specific IgE antibodies.
Like the allergy blood tests for humans.
That's kind of, yeah. Then there's intradermal allergy testing, IDT. That's where you inject tiny amounts of different allergens into the skin to see which ones react. It's considered the gold standard for skin allergies in many species.
But tricky in camelids.
Very tricky. Often needs sedation, which has risks, and there's a lack of validated protocols, standardized allergen panels specifically for them. So it's not routinely done everywhere. The most crucial step, though, before jumping to allergy, is ruling out those big differentials.
Like the sura and mange you mentioned.
Exactly. Trypanosomiasis, sarcoptic mange, also dermatophilosis, that's a bacterial skin infection, or even viral things like camelpox. Got to rule those out first.
Right. So let's say you've gone through that whole diagnostic maze, ruled out the bad stuff, and you're pretty sure it is an allergy. How do you actually manage it?
Management really focuses on two things: symptomatic relief for the animal, and, if possible, identifying and removing the trigger, the allergen.
Makes sense. What about medications?
Pharmacotherapy often involves antihistamines, H1 blockers, like diphenhydramine, to counter the effects of histamine. For more severe inflammation, corticosteroids, like dexamethasone or prednisolone, might be used.
But there's a catch with steroids, right? Especially in
A
females.
huge catch. You have to use extreme caution with corticosteroids in pregnant camelids. Even just topical contact, like rubbing against treated bedding, can potentially induce abortion or cause other severe pregnancy complications. It's a critical warning.
Wow, okay. Good to know.
And of course, if there's a secondary bacterial infection from scratching, or if parasites are involved after all, then appropriate antimicrobials or antiparasitics are essential. Beyond meds, environmental control is key. Insect control, good hygiene, maybe changing feed if a food allergy is suspected.
Yeah.
Careful management. Unfortunately, allergen-specific immunotherapy, allergy shots, that's not really well documented or commonly used for camelids yet.
Okay. Fascinating stuff on the camelids. Now, let's switch gears. Let's talk Cervidae, our deer, elk, moose. Here, the allergy story takes this really interesting kind of globally relevant turn, particularly for us humans.
Yeah, this is where it gets really interconnected. If you look at the big picture, probably the most significant allergic phenomenon linked to cervids isn't actually a disease in the deer themselves.
Oh.
It's alpha-gal syndrome, or AGS. This is a unique food allergy affecting humans, and it's vectored by ticks.
Ticks again.
Ticks again. And deer play a crucial role here. They serve as primary hosts for certain ticks, like the lone star ticks, Amblioma americanum.
Yeah.
And critically, they act as a reservoir for the actual allergen, the alpha-gal sugar molecule.
So the deer aren't allergic, but they carry the thing that makes us allergic.
Exactly. It positions deer not really as the patient in this scenario, but as this vital epidemiological link in what we call a one health issue, where wildlife health, environmental factors, and human health are all intertwined.
This alpha-gal syndrome, it's incredibly weird, isn't it? I mean, an allergy to a sugar. And that delayed reaction, that's not typical for food allergies.
It's absolutely unique. Most food allergies are to proteins, right? But AGS is triggered by a carbohydrate specifically, galactose-1-free galactose, or alpha-gal. And yeah, that delay is characteristic. The reaction doesn't happen right away, but typically 3 to 6 hours after eating mammalian meat.
Like venison, beef, pork.
Exactly. Things that contain alpha-gal. The mechanism involves ticks feeding on deer, picking up alpha-gal from their blood. Then, when that tick bites a human, it injects the alpha-gal, sensitizing the person's immune system. They develop IgE antibodies to this sugar.
And then eating meat triggers it. What are the symptoms?
They can range quite a bit, from hives, itching, swelling, to severe gastrointestinal problems, all the way up to life-threatening anaphylaxis. It's a really stark reminder of how connected we are to wildlife and the environment through things like ticks.
Definitely a One Health poster child.
Yeah.
So, okay, deer are key players in AGS for humans. But do deer themselves experience other conditions that look like allergies?
They certainly can, yes. Insect bites, for example. We know bites from things like the deer ked can cause really intense itchy inflammation in humans, a delayed type hypersensitivity. It strongly suggests that deer themselves are likely affected by similar reactions to insect saliva.
Makes sense. What else?
Another really important condition to mention is photosensitization. Now, it's crucial to clarify, this looks a lot like a severe allergic skin reaction, but it's technically not a true allergy.
Okay, so what is it then?
It's a phototoxic reaction. It happens when an animal eats certain substances, either phototoxic plants like St. John's wort, or sometimes fungal toxins like sporismin from pasture fungi. These substances either deposit directly in the skin or, more commonly, damage the liver.
The liver, how does that affect the skin?
A damaged liver can't properly process certain plant pigments like chlorophyll breakdown products. These build up in the bloodstream and deposit in the skin. When sunlight, specifically UV light, hits that skin, yeah, it triggers a severe reaction. Bad sunburn, blistering, swelling, skin death, often affects pale or unpigmented areas like around the face and ears. We sometimes call the liver damage type facial eczema. Looks horrific, mimics severe allergy, but it's driven by light and toxins, not IgE.
Got it. Photosensitization, not allergy. And just like with camelids, I assume deer themselves, their dander, hair, saliva can be allergens for humans?
Oh, absolutely. Deer dander, hair, and saliva are known to be potent allergens for susceptible people, causing allergic rhinitis, asthma, sometimes contact urticaria if they handle deer hides or meat.
So diagnosing issues in deer sounds even harder than in camelids, given most are wild.
Significantly harder, yeah. Their wild or semi-domesticated nature just limits what you can realistically do diagnostically. In wild deer, any diagnosis is often presumptive, based on observing signs from afar, or sometimes confirmed only after death post-mortem.
Are there any tests?
Well, for the human side, there are IgE tests for deer allergens, deer epithelium, venison. But applying those tests to diagnose allergies in the deer themselves, that's not really established or practical. And again, differential diagnosis is key.
What else could it be?
You have to consider serious wildlife diseases, chronic wasting disease, CWD, which affects the brain and causes animals to waste away, epizootic hemorrhagic disease, EHD, a viral disease causing fever, swelling, often sudden death near water. Even things like cutaneous fibromas, those are generally benign skin tumors, but they can look alarming.
So managing these issues must be totally different for wild deer versus, say, deer on a farm.
Completely different approaches. For wild populations, you're not treating individual animals. Management focuses on the bigger picture. Overall population health, maybe managing deer density in some areas to try and reduce ectoparasite loads, which could, in turn, help reduce alpha-gal syndrome transmission risk to people. It's about ecosystem management.
And farmed deer.
With farm deer, you can intervene more directly, managing itching, if it occurs, but especially crucial is managing that photosensitization risk. That means careful pasture management, maybe removing animals from fields with offending plants, or high fungal spore counts, providing plenty of shade, monitoring liver health. Good general husbandry nutrition, stress reduction, parasite control is also fundamental.
What about drugs like antihistamines or steroids for farmed deer?
If needed for an allergic-type reaction, pharmacotherapy would generally be extrapolated from what we know in other ruminants, like cattle or sheep. So yes, potentially antihistamines for acute reactions, maybe corticosteroids for severe inflammation, but you'd have to be very careful about things like withdrawal times if the animals are intended for meat production.
Okay, so let's try and bring this all together. We've looked at camelids, we've looked at cervids. What are the big takeaways when we compare these two fascinating groups?
Well, I think what's truly striking is how their immunological paths have diverged so fundamentally. The biggest difference, really, is that unique camelid immune system feature the heavy chain-only antibodies.
The nanobodies.
Exactly. Compared to the conventional mammalian immune system you see in cervids, like deer. This fundamental difference likely impacts how they recognize antigens, how their bodies mount allergic responses. It's a core distinction.
And that seems reflected in the types of allergies we see or associate with them.
It does seem that way. You see this reflected in the dominant allergen types we discussed. For camelids, it's often classic protein allergens, dander, milk proteins, insect saliva. Whereas for cervids, the most significant allergic phenomenon we talked about involves that carbohydrate, alpha-gal, primarily because of its impact on human health.
And just the main allergy story for each group feels really different too, right?
Absolutely. It's a key contrast. For camelids, those allergic-like signs often act as this vital warning sign, potentially pointing towards serious underlying parasitic diseases like Sura or mange that demand immediate attention.
A red flag.
A red flag, exactly. Whereas for deer, the biggest allergic syndrome in the conversation is actually that zoonotic issue, alpha-gal syndrome, where the deer itself is largely an asymptomatic host, but plays this critical role in a disease affecting humans. It highlights very different ecological and health connections.
Given all this complexity and the differences, it really raises an important question. What are the biggest gaps? Where do we need more information?
Yeah, you're right to ask. There are significant gaps. A major one is the lack of validated, reliable, species-specific diagnostic tools for both groups. This makes it incredibly challenging sometimes to confidently differentiate a primary allergy from all those other conditions that can mimic it.
So diagnosis is still a major hurdle.
It really is. And therapeutic options, as we mentioned, are largely extrapolated from other species. We don't always know the ideal doses or potential side effects in camelids or cervids specifically. Think about that corticosteroid risk in pregnant camelids. We need more species-specific knowledge.
And especially for wild animals, right?
Definitely. Our knowledge about allergic conditions and free-ranging populations is particularly limited. There are huge gaps in understanding animal health out there in the wild.
But presumably, there's hope. A path forward for research, for vets, for wildlife managers.
Oh, for sure. There's a clear need and direction. From a research standpoint, we really need to better characterize the primary allergic syndromes in both camelids and cervids. We need to properly study the role of those heavy chain antibodies in camelid immune responses. How do they influence allergy? And, critically, develop and validate those species-specific diagnostic tests we talked about.
And more on alpha-gal.
Yes. Further research into AGS epidemiology, tick vectors, reservoir hosts, that's vital too. For veterinary practice, it really emphasizes the need for systematic diagnostic workups. Rule out the common infections and parasites first.
Don't just assume allergy.
Exactly. And use therapeutics judiciously, being really mindful of specific warnings, like with pregnant camelids. Client education on environmental management is also key. And then for wildlife management.
A One Health approach.
Precisely. Adopting that One Health perspective for things like AGS, maybe managing deer density where appropriate, definitely public education on tick avoidance.
Oh.
Plus habitat management, nutritional support, and good biosecurity for farmed herds. It's all connected.
Wow, what a journey into this, well, really surprising world of camelid and cervid allergies. We've seen how camelids have this almost sci-fi immune system with their nanobodies.
Game-changing potential there.
And how deer, often unseen, play this central role in a really cutting-edge human food allergy.
Indeed. It just powerfully underscores how species-specific immunology really shapes health outcomes, doesn't it? And how closely animal health and human health are tangled together in the bigger ecosystem. There's always more to learn.
Yeah.
Significant research gaps still exist.
Absolutely. And maybe for you, our curious listener, here's something to chew on, building on what we've discussed. Could it be that these species, camelids and cervids, having evolved under this constant diverse pressure from their environment, from parasites, could they actually possess immune systems that are maybe more tolerant to common environmental allergens compared to, say, highly domesticated species like dogs or cats? Could they hold clues to preventing allergies elsewhere, maybe even in us? Something to think about.